Good evening. My name is Sara Jo. I'm the Public Health Director for Lincoln Trail District Health Department. There are now 4 documented cases of COVID-19 within the Lincoln Trail District Health Department service area, 2 in Nelson and 2 in Hardin. But the reality is that COVID-19 is in our communities and has probably been circulating for weeks or even months. The first confirmed test only proved what everyone should have already known. I'd like to show you a comparison of how disease typically spreads in Kentucky. I show you this comparison realizing that it is imperfect and a generalization. The first map shows the beginning of flu season. I understand that we have more resources to deal with flu. For example, there is a vaccine readily available to prevent flu or lessen its effects. There are also tests that can be used to diagnose patients, as well as treatment through the use of antivirals. At this time, much of COVID-19 is still relatively new or unknown. I show you this to highlight the fact that when you look at the beginning of the season, there are many counties that may say we are safe. We don't have it here. We don't need to take action. In fact, because we have not had very many confirmatory tests until recently, many may have a false sense of security. As a result, we have seen many people ignore the strongly recommended preventative measures to slow the spread of this disease. However, when you take a look at the second flu map, you see that such thinking is not correct. Flu was on its way, and it was necessary in September for individuals to start taking action to protect themselves. The healthcare system had time to prepare for an influx of patients, and employers were able to prepare for the likelihood of sick staff. Just like the first map showed the initial onset of flu, this map illustrates the beginning stages of COVID-19. We will probably never know how many people in our community have been exposed to COVID-19. Many of them will have no symptoms or mild symptoms and will never seek services or testing through the healthcare providers. The best thing we can instruct people to do at this point is stay home. Anytime we don't, we risk being exposed or exposing vulnerable people within our community, as we may have the virus and not know it. Seeking testing when not symptomatic has consequences. Taking well or mildly ill family members to acute care facilities or our emergency departments will increase the risk of exposure for yourself, your family member, our healthcare providers, or other very ill people. Here's another perspective on testing. Each time a provider does a test, they must wear personal protective equipment, or PPE. They have to put on gloves, an N95 mask, gown, and a face shield. In our ERs and doctors' offices, when they're flooded with individuals who want just a peace of mind but otherwise do not need a test, it depletes PPE that is already in short supply. To put this in perspective, PPE is needed when surgeons do heart surgery or OB providers deliver babies or any other necessary procedures done by our medical personnel. Additionally, test results will not change the course of your treatment if you are sick, and testing resources need to be used on those who are most ill. On your screen are the testing numbers for Kentucky as of March 25th. These numbers change daily. The number of people tested for COVID-19 is 3,300. Those who have tested positive are 198, and the number of deaths are at 5. Let me repeat, this virus is very contagious and spreads easily. Even if you are not currently experiencing symptoms, you could be spreading the virus to others. Let me illustrate what this looks like. Imagine what would happen if a person infected with COVID-19 has no symptoms and joins a group gathering. It is like a buckshot. When they leave, they will scatter and spread it everywhere they go. Also, if one infected person goes house to house, providing a service, it is like a honeybee going flower to flower, spreading the disease throughout a community. We all have to do our part to slow the spread of this disease. Social distancing has to become the norm. We must move past the rule doesn't apply to me mentality. This way of thinking undermines the sacrifices that others are making to protect the health of our most vulnerable citizens. Please ask yourself each time you travel anywhere, is it worth it? Is it worth it if I get sick? Is it worth it if I cause others to get sick? And is it worth it if that illness takes a life? This also applies to non-essential businesses that are not doing their part to protect the public by closing their doors. For those of you that are doing the right thing, even though it is challenging, I want to say thank you. I also want to let you know the criteria for individuals who are considered high risk for COVID-19 complications has been updated by the Centers for Disease Control and Prevention. Those considered at highest risk include individuals 65 and older, people with chronic medical conditions, people who have a weakened immune system, and individuals who live in nursing homes or long-term care facilities, or those that are severely obese. As a final thought, we are all in this together. It will take all of us doing our part to make a difference on the slowing the spread of this disease. Thank you for your assistance.